Welcome back. Still to come, all the gossip from last night's Inside Soap Awards and a look ahead at some of the week's biggest soap storylines.
But now, lots of schools have broken up for half-term this week, and while the children are probably relishing a break from class, it can leave some parents feeling at their wits' end, especially if they're dealing with difficult behaviour.
Well, with behavioural problems on the rise and experts calling for mental health checks on children as young as 7, Dr. Ranj has been looking at the true extent of the problem.
Around 1 in 10 children aged 5 to 16 suffer from a diagnosable mental health disorder. That's around 3 in every class. 80,000 children and young people are believed to suffer from severe depression, while 1 in 5 young adults now show signs of an eating disorder. The range of problems that can affect this group is vast and include conditions such as anxiety, depression, self-harm, OCD and schizophrenia. At the other end of the spectrum are behavioural problems like temper tantrums, which aren't uncommon and can be challenging to manage. Some neurodevelopmental conditions such as autistic spectrum disorders and ADHD can also be behind difficult behaviour and require specialist help. Changes in your child's behaviour may emerge as a direct response to what is happening in their lives, such as moving home or school or stress or bullying can all act as a trigger. Awareness and early intervention is vital, as childhood and teenage years can be a vulnerable time in terms of mental health, and patterns are set for the future.
Well, Dr. Ranj joins us now, and you wonder what is happening to our young people, to our children. If you think back to, glory days, I suppose, maybe before the war and kids were running off through cornfields, did any of them have ADHD?
They probably did, but the thing is, we know that mental health conditions in young people have been increasing, and the reasons for that are fairly complex. Undeniably, it's probably because we're picking it up more often, we're better at identifying it, and we're better at diagnosing it. Part of it is also, controversially, I think, because diagnostic criteria have changed over the years, and actually it might be easier to diagnose people. And finally, there is this argument that actually, are they becoming more common? Are more and more children getting these conditions? And the reasons for that are quite uncertain. Could it be genetics? Could it be the environment and the world we live in? Could it be the pressures of, today's society? And is it the fact that we aren't getting enough early support and intervention that we might have had in the past? Families are very different now than they used to be, and we don't necessarily have all the support and input that we used to have.
Well, is it very helpful then, in today's papers, there's a story of an autistic 5-year-old boy who's been expelled after being called the naughtiest little boy his headmistress has ever met?
Yeah, it's very difficult to comment on these individual sorts of stories because we don't know the exact ins and outs, but what it does highlight is how autism and ADHD can be quite difficult to understand and get your head around. But not just that, but accessing help and support for these children, which sometimes can be quite significant and quite specialist, is difficult, actually, and being in a mainstream school might not be the ideal place for them.
He was reportedly asked to leave after he pushed another child into a bookcase. We're taking this story from the papers. We don't know what happened on that day. I don't know whether there's been lots of previous. But having said that, kids can just be boisterous. They can just be a bit naughty. It doesn't mean they've got a problem.
Exactly, and that's where the spectrum of normality or ADHD-ness comes into it.
So do we label children too quickly?
There's a worry that we might do that, but what we must remember is that having ADHD is very different to just being naughty or being boisterous. These are children that have real difficulties with maintaining attention, with hyperactivity, with acting impulsively. And the thing is that, there are real strategies and help that is available, and it's important for them to be able to access that.
OK, so what is the difference then between, now I'm going to try attempt this, behavioural, neurodevelopmental,
yeah.
That's the one, and mental health problems? So if you're sat there at home and you're looking at your child thinking, well, they're very naughty and occasionally they push me so much, what are the differences then? How can you recognise that?
That's it. Every parent wants to know, at what point do I need to worry? Behavioural problems is like an umbrella term we give to any behaviour that might be unusual or abnormal or problematic. And, it can range from anything like temper tantrums, toileting problems, tics and mannerisms, problems sleeping, night terrors, that kind of thing, which are usually transient and easy enough to manage, but it can be quite significant in a small proportion. And also, some behavioural problems are caused by things like neurodevelopmental problems like ADHD, autism, dyslexia, dyspraxia, that kind of thing, and some are caused by mental health problems. So that's things like anxiety, depression, OCD, schizophrenia, bipolar disorder. So behavioural is the overall term, and there are these specific subsets that we can and should identify because they can get specific help.
So that some acquired from circumstances, from environmental issues, whatever that may be, some wiring.
Yeah, well, some can be triggered. That's the thing. You know, it's a small change like changing schools or stresses at home or, you know, bullying can trigger some things off. It's important to get the help and support that you need and identify those small proportion that do have an underlying disorder.
So what do you look for? What is it that may tell you that your child has a problem?
There's no one answer to this, and the array of symptoms is quite complex. But as a general rule, firstly, a significant change in mood that's persistent and pervasive, so happens in different situations at home and at school and for a long period of time. That may be a clue that something's going on. For instance, if your child is a low mood for a long period of time, that's a clue that something's not quite right. If they've got difficult behaviours or intense feelings out of proportion to what they should be, so extreme aggressiveness, extreme shyness or anxiety that isn't unfounded, then you might need to look into that. Unusual food-related behaviour, for instance, being secretive around food, extreme fussiness or unexplained weight loss may be a clue that there's something going on there, particularly around eating disorders. Sleep trouble, classically, can be normal part of childhood behaviour, can just be a phase, but can also be indicative that there's something like depression or anxiety going on. There's a difficulty going to sleep. And finally, things like, that might be quite obvious, but self-harm, drug use, substance misuse are a strong clue that something is going on which may or may not have an underlying mental health cause. And there are obvious things, like if your child is hearing and seeing things, obviously you're going to think something isn't quite right and you may need to seek help.
What should you do then? So you say seek help. If you recognise any of those symptoms, what happens next? Well,
the big thing I tell every parent is talk to someone. Talk to friends or family, see if they've noticed the same things. Talk to teachers, really good resource actually, because they spend a long time with your child and they're likely to have picked up on some of the things that you may or may not be worried about. There's always your GP or your doctor, and they might be able to refer you on to a specific counselling service or a specialist child and adolescent mental health service who can assess for specific mental health problems and help in that way. There's loads of stuff online, so there's loads of great websites, Young Minds UK, the site, Mind have a great mental health resource there, and they've got helplines as well, which can be quite useful for parents. And there are some things that parents can do themselves. For instance, if you've got a young child, they might respond well to structure and guidance and, you know, giving them a good routine.
Harry does.
Exactly. That's the thing, that they really like, almost like rules in a way, and they like to have boundaries. With older children, it's all about being available for them, showing them that you care and being open to communication, being honest with them. Be a parent before a friend, because you need to own your parent role, because they are going to want guidance and reassurance from you. And also encouraging the obvious things like having a good diet, a healthy lifestyle, good sleep pattern. That will help because your physical health has an impact on your mental health and vice versa. And also I always remind parents that sometimes our children have issues that reflect us. So if there's something in yourself that you're uncertain about, or if you're having issues yourself, it's just as important for you to go and get help and talk to someone as it is for your child.
They're like little sponges.
That's it, and they will mimic behaviour, they will learn from you, and they will reflect some of what's going on with you. So don't just think it's just about your child. Often it's about a lot more, and it's about the family around them.
Brilliant. Thank you very much.
That's brilliant. Thank you.
Thank you.
Thanks ever so much.
You should come in and we'll do a phone-in.
Yes, good idea. Right, details, everything Dr. Ranj has just discussed can be found on our website, along with advice of where to go for help and support.
We're back after the break.
Thank you.